New York prepares for a coronavirus tsunami as other major cities build their seawalls. New information suggests coronavirus may be far less deadly than originally suspected, and President Trump mulls over how to reopen the economy. I'm Ben Shapiro. This is The Ben Shapiro Show. Today's show is sponsored by ExpressVPN. Don't let others track what you do. Keep yourself safe at expressvpn.com/Ben. Go check them out, expressvpn.com/Ben. Alrighty, so we bring you all of the updates. The biggest update, of course, is that the U.S. now leads the world in confirmed coronavirus cases, and members of the media are going nuts over this. The United States, we're number one. That was trending on Twitter yesterday. Wow, we're number one. People suggesting that this shows that America really is a third world country. Julia Jaffe, the execrable columnist for GQ, she actually tweeted out, "Who's the bleep hole country now?" Who's the bleep hole? That, of course, is supposed to be making fun of President Trump, who suggested he didn't want people immigrating from bleep hole countries because they might not actually be the best American citizens depending on the culture from which they came. Again, that was a very controversial comment at the time and poorly expressed by the president, but let's just put it this way. The United States is not a bleep hole country because we have a lot of tests, okay? If you were going to identify which countries are having the hardest time with coronavirus, the United States, yes, we are having a rough time with coronavirus. It is not even close to the countries that are having the toughest time with coronavirus. How can we tell? Because what doesn't matter is the number of cases diagnosed. What does matter is the number of cases of deaths over the number of cases a country has. Right? That would be a good measure. Truly, because you cannot measure the ability of a country to deal with a crisis by simply the bottom line number as to how many people have experienced the crisis. It's how those people actually recover from the crisis, how many people die. So while it is true that the United States now has the most cases of diagnosed coronavirus, that is largely because China has undoubtedly been lying about the coronavirus situation in China. Supposedly, according to China, they're having like 25 new cases of coronavirus a day. Does anyone believe that? Literally the day after they expelled American journalists, they apparently stopped testing in China. That is according to sources inside China. Beyond that, the United States right now, as of now, has about 86,000 confirmed cases of coronavirus in the United States, about 1,300 deaths. Okay, that's not spectacular, but that means a death rate of approximately 1.3%. Italy has 81,000 cases of coronavirus and 8,200 deaths. Okay, so 8 times as many deaths as the United States, about 8 times about as many deaths as the United States, and fewer diagnosed cases. Spain has 64,000 diagnosed cases and nearly 5,000 deaths. So the notion that the United States is a bleep hole country because of the number of coronavirus diagnoses is ridiculous. I mean, France has more deaths right now, and they only have 30,000 diagnosed cases. By the way, nationalized healthcare systems in most of these places. So the kind of triumphalism, a very weird triumphalism you're seeing from the media. Well, now that the United States has the most coronavirus cases, that demonstrates that the United States is the worst country. Or alternatively, it demonstrates that you don't understand math. So maybe we have the worst math programs in the country because you idiots don't understand what a numerator and a denominator are in terms of determining rates. But with that said, no, again, the United States is dealing with this thing so far. And the big question is going to be whether coronavirus overcomes the capacity of the healthcare system. That has been the question for a long time. I've been talking about it on the program for weeks at this point. When we talk about flattening the curve, the point of flattening the curve is not that everyone will not eventually get coronavirus. In all likelihood, everyone will eventually get coronavirus. The question is whether that swamps our capacity to deal with it. And right now, it is unclear exactly how much we are going to be swamped because we're seeing reports that suggest we're going to be swamped. The media obviously are trying to kind of get ahead of those reports. We saw Casey Hunt over at NBC News tweet out earlier today that hospitals were already making decisions about who would get a ventilator and who would not, except for the fact that hospitals are not actually doing that at this point, right? And so the notion that we are like being overwhelmed right now, right this second, we don't know that yet. Right? There have been these forecasts that we were going to get overwhelmed by earlier this week. I remember Andrew Cuomo suggested that by Tuesday, New York City's hospitals, ICU beds, their ventilators were going to be overwhelmed. And then the suggestion was that by today, by Friday, that the New York system was going to be overwhelmed. And we'll see whether it is indeed overwhelmed, although the reality is that most of the New York public officials are saying right now that they are not overwhelmed, right? That is as things stand at current. But the United States does lead the world in confirmed coronavirus cases because we are ramping up testing, which is a good thing. We should be ramping up testing. You want to get back to work? You want to know how bad this thing is? We need more testing. And we need tests of blood serum. We need to know whether people have developed the antibodies. Because one of the things that we're trying to figure out right now is just how deadly this thing is. What exactly are the death rates? And that is something that we'll have. And by the way, I strongly suspect that not tens of thousands, not hundreds of thousands, but millions of Americans actually have had coronavirus. That is my deep suspicion, not just my suspicion, by the way, the suspicion of virtually everybody who has taken a look at these numbers. Now, yesterday, we had on a doctor from Stanford University suggesting that he thinks that if you take the number of people, broadly speaking, across the United States who have had coronavirus or do have coronavirus and don't know about it and experience no symptoms or mild symptoms and then moved on with their life, if you take that number and you take the number of deaths over the actual number of people who have had or do have coronavirus, you're looking at a death rate that actually does look much more akin to the flu. Now, that does not mean you're not going to see more absolute death in the United States, because if 300 million people get it and it has the same death rate as the flu, you are still going to end up with like 5 times as many people dying from that as from the flu, because every season in the United States, you get about 50, 60 million people with the flu. If instead you had 300 million people with the flu, more people on an absolute level will die. This is how percentages work. But the reason I suspect this is because you're seeing a lot of prominent people come down with this thing, right? Boris Johnson, the Prime Minister of Great Britain, announced today that he has mild symptoms of coronavirus, and he tested positive for coronavirus. So the question becomes, why is it that all of these prominent people are getting coronavirus, right? You got the NBA, where a bunch of people have coronavirus. You're seeing celebrities like Tom Hanks and Rita Wilson have coronavirus. You're seeing fairly famous people come down with coronavirus. So the question is this a thing that like only famous people are getting? Or alternatively, is it that in a time of a shortage of testing, is it possible the only people who are getting tested are the celebrities, right? Which is probably the accurate assessment of the situation, right? The NBA was getting early tests because all those people are rich and famous and celebrities, and they have hookups with doctors, and they can get a connect. So it's not that only NBA players are getting it, or that only Prime Minister Boris Johnson is getting it. It's that you may have had it, or you might have had it, but you didn't get a test because you're not famous, and because the tests are hard to come by. Okay, so according to the New York Times, the United States is the world's 3rd most populous nation. So of course, that's not a shock that we also have the world's highest number of coronavirus cases. And also, it's difficult to compare the United States to like Italy, right? Italy has nearly as many cases as we do, and they have 60 million people. We have 330 million people. So on a per capita basis, we're not even close to number 1. On a per capita basis, we're somewhere in the middle of the pack, actually, in terms of diagnosed coronavirus cases. If you took the United States versus the EU, which is closer to apples, then you would be looking at the EU just swamping the United States. And as I say, China is number 1 in terms of population. India is number 2 in terms of population. We have no actual data on, I think that's right. I think China's more than India, but it's pretty close. In any case, we don't actually have any data from India, and China's been lying about their data. So we don't actually know if the United States is number 1. That, again, is not stopping people in the media from suggesting that this is because the United States is uniquely weird and evil and all of this. It's very, very weird. The same people who will accuse religious Americans of having this apocalyptic view of the United States, accuse religious Americans of sitting around going, well, God is sending a plague on this cruel nation, right? Those same people are sitting around going, well, the United States, we're a bleep hole country. We sort of had this coming, didn't we? We sort of deserved it. They have this very weird sort of quasi-religious view that Mother Nature is taking her revenge in some sort of vague sense. It's very weird. Okay, well, we'll get to more of this in just one second, because there is good news today and there is bad news today. And we're going to get to the bad news first, and then we'll get to some of the good news as to where things stand, because again, there's a lot of data floating around that we're going to try to go through all of it. The theme of the show, if you haven't noticed for the past several weeks, is I don't know, and you don't know, and anybody who claims they know is lying to you. Okay, so when you watch the media, and you watch the media's narrative on this thing evolve in real time, understand that's because the data is moving around. Some people are going to be honest about that, and some people are going to lie to you about that. We're going to be honest about that and suggest we don't know what we don't know. Okay, because right now there's this sort of pressure for everybody to come down hard, for people to go to their priors, to people immediately to declare it's either a huge problem or no problem at all. And we're not going to do that. We're just going to give you the data, and then we're going to, kind of comment on how people are reacting to it. Okay, so as I say, that was the big headline, that the United States is number 1 in terms of coronavirus diagnoses. But that doesn't make a huge difference, because who cares? It's really how many people die compared to that number and whether the health system gets overwhelmed. Now, speaking of that, Scott Gottlieb, who is the former Trump head of the FDA, has become one of the trusted voices on this thing. He put out a chart showing the emerging situations in various American cities and how exactly the deaths are doubling. In New York City, basically deaths are doubling every couple of days. Andrew Cuomo suggested that is starting to flatten out, that thanks to the social distancing, thanks to the lockdown, that is starting to flatten out a little bit. Michigan is really jumping. Michigan has a very steep curve right now in terms of the number of people who are dying every day. Again, there's not a lot of data. You're like 4 days into some of these charts, right? Michigan's only being measured after like 4 days, basically. You're seeing a pretty sharp curve up in New Jersey. You're seeing a fairly sharp curve in Georgia. California, for some reason, is lagging, and that's interesting. Right? Florida is also kind of lagging, and that's interesting as well. There was an article in the Associated Press asking why Los Angeles, for example, has so many fewer diagnosed cases than New York City. Part of that may be lack of testing. Part of that is undoubtedly the fact that being a lifelong resident of Los Angeles is a much more spread out town. I mean, New York, everybody is right on top of each other. The subways are always crowded. There are going to be some serious questions to be asked, by the way. People are talking about Andrew Cuomo, presidential candidate. Look at all of his great leadership. There are going to be some fairly serious questions to be asked to Andrew Cuomo and Mayor Bill de Blasio, if this really does get bad in New York City, as to why they were leaving public transportation running in the middle of all of this. Seriously, why were all the subways running? I mean, those are the places that are most likely to be the areas in which people acquire coronavirus. It's a bunch of hard surfaces in small areas underground, right? That's going to be, what you're noticing here, by the way, is that many of the areas that have public transportation systems are the ones that are getting the hardest hit. It turns out that maybe your personal protective equipment was your car. Being on public transportation is a place where you're most likely to acquire germs. Gottlieb said, I'm worried about emerging situations in New Orleans, Dallas, Atlanta, Miami, Detroit, Chicago, Philadelphia, among others. New Orleans is seeing a pretty sharp spike right now. In China, no province outside Hubei ever had more than 1,500 cases. In the United States, 11 states are already hit that total. Our epidemic is likely to be national in scope. Well, it is true it's likely to be national in scope, but there are likely to be differences by area. We're going to get to that in just a moment. Meanwhile, again, all eyes on New York City, because New York City is sort of the canary in the coal mine. It is the epicenter of the outbreak in the United States. According to the New York Times, the New York City death toll hit 365 last night. The case count topped 23,000, which means that somewhere between 1/3 and 1/2 of all cases in the United States are happening in New York City. Health officials reported late Thursday that New York City had added 3,100 new confirmed coronavirus cases since the same time on Wednesday, bringing the total to 23,112. By comparison, more than 4,400 new cases were added from Tuesday to Wednesday, so maybe the curve is starting to flatten out. Andrew Cuomo had suggested that, the governor. The number of virus-related deaths climbed to 365 on Thursday, up from 280 the day before. From Wednesday morning to Thursday morning, 100 people died of coronavirus in the state overall, said Andrew Cuomo at a news briefing on Thursday. He said the number of patients hospitalized in New York had shot up 40% in a day, which was the sharpest increase in days. He said that older and weaker patients have been keeping on the ventilators for 20 days or longer before they succumb to respiratory failure. So that means that the shortages that we're talking about are not just number of ventilators versus number of people who are sick. It is also that once you're on a ventilator, you're staying on a ventilator for quite a while. He says the longer you're on a ventilator, the more probability of a bad outcome. He said the governor emphasized that the numbers on any single day did not necessarily capture the damage being caused by the virus. He said when you talk to projection models, what they'll say is you get a fluctuation. They don't know if it's a deviation in what hospitals happen to report that day. So he says don't take the day-by-day numbers in New York. Take the 3-day averages, the 3-day swinging averages. However, Cuomo did express some optimism that perhaps New York was, in fact, slowing the growth of the curve. With all of that said, we're still trying to figure out where these projections end up, and it's very difficult to tell where these projections end up at this point. There is the suggestion that the peak is not going to be hit until sometime in April. There's one study that came out, I mentioned it briefly yesterday, from the University of Washington School of Medicine, suggesting the coronavirus pandemic could kill more than 81,000 people in the United States in the next 4 months and might not subside until June. They say the number of hospitalized patients is expected to peak nationally by the second week of April, though the peak may come later in some states because, again, this thing does not spread perfectly evenly. Some people could continue to die of the virus as late as July, although deaths should be below epidemic levels of 10 per day by June at the latest, according to the analysis. The analysis has a wide range of outcomes, ranging from as low as 38,000 deaths to as high as 162,000 deaths, which is why, again, you should take every prediction with a grain of salt. When the range is literally fourfold, it is very difficult to tell exactly where this thing is going to go. The variance is due in part to disparate rates of the spread of the virus in different regions, which experts are still struggling to explain, said Dr. Christopher Murray, director of the Institute for Health Metrics and Evaluation at the University of Washington, who led the study. The analysis also highlights the strain placed on hospitals at the epidemic's peak. Sick patients could exceed the number of available hospital beds by 64,000, could require the use of around 20,000 ventilators, which is interesting because that study says 20,000 ventilators. New York alone has been calling for 30 to 40,000 ventilators. So this study from the University of Washington says that at peak, you might need 20,000 ventilators. That's half of what we were being told like days ago about the 40,000 ventilators that were going to be needed. The doctors at University of Washington, they said the virus is spreading more slowly in California. They say that peak cases there would come later in April. Social distancing measures might need to be extended in the state for longer. They expect that Louisiana and Georgia are going to be fairly hard hit throughout all of this. Okay, all of this has led to the politicization of talk around ventilators. There's a story from the New York Times We're going through all the bad news, and we'll get to some good news, so don't worry. It'll be balanced out in a moment. There's a story from the New York Times that the Trump administration had almost cut a deal with General Motors and Ventec to produce all of these ventilators. The story is by David Sanger, Maggie Haberman, and Zolan Kano-Youngs. See, the White House had been preparing to reveal on Wednesday a joint venture between GM and Ventec Life Systems that would allow for the production of as many as 80,000 desperately needed ventilators to respond to an escalating pandemic when word suddenly came down that the announcement was off. Now, notice, it really is fascinating how variable all these numbers are, right? Again, I go back to my main point. Nobody knows anything. Okay, that University of Washington study says that at peak, we might need 20,000 ventilators. This story is about how the U.S. government was going to try to acquire 80,000 ventilators. Now, listen, I'd rather have too many than too few, obviously. But when you are off by, a factor of 4 in some of these predictions, it is very difficult. I mean, this is all catch as catch can. It is incredibly sloppy. And that's just the way that life is sometimes. But let's recognize that this is not pinpoint accuracy. We have the hard data. We know what the science, we don't know a lot of things. The decision to cancel the announcement, government officials say, came after FEMA said it needed more time to assess whether the estimated cost was prohibitive. That price tag was more than $1 billion, with several $100 million to be paid up front to GM to retool a car parts plant in Kokomo, Indiana, where the ventilators would be made with Ventec's technology. Government officials said the deal might still happen, but they're examining at least a dozen other proposals. They contend that an initial promise that the joint venture could turn out 20,000 ventilators in short order had shrunk to 7,500, with even that number in doubt. So that would be the actual story, right? The way that the New York Times played this and the way that the reporters tweeted this out was that the Trump administration was on the verge of generating all the ventilators overnight tomorrow, and they just decided $1 billion was too much. And so people on Twitter were like, okay, hold up a second. We're spending $6 trillion and you can't find $1 billion to provide the ventilators? But that's not what's happening here. It sounds like GM couldn't even guarantee they were going to produce the ventilators. It sounds like they didn't even know they were going to produce 7,500 ventilators. And so the government, FEMA, went back and opened up the contract and said, okay, well, let's get some competitive bids in here. Longtime emergency managers at FEMA are working with military officials to sort through the competing offers and federal procurement rules while under pressure to give President Trump something to announce. Okay, with all of that said, President Trump got himself in a little bit of hot water yesterday because he suggested that we don't actually need 40,000 or 30,000 ventilators. He said you go into major hospitals sometimes and they will have 2 ventilators. And now all of a sudden they're saying, can we order 30,000 ventilators? People in the media, again, fulminating over President Trump saying that, but there's been no information that Trump is actually denying New York what it needs. Like Cuomo's calling him up and saying, I need 30,000 ventilators. And Trump's like, I don't believe you. Here's 2. They're giving them all the ventilators they can get their hands on. I mean, Cuomo himself has said that at this point. Okay, as far as where this is all going, Dr. Anthony Fauci did say yesterday, we're not going to work by Easter, right? There's no information to suggest that we're all back at work by Easter. That is very likely. I mean, that would be April 12th. It's already March 27th. We're likely not to hit the peak according to any study until around Easter. That is the most likely time when we hit the peak number of cases in the United States, according to sort of the pandemic studies, the pandemic methodologies that are being applied. Here's Dr. Anthony Fauci saying, no, Easter is a little bit optimistic.
I think that the president was trying to do, he was making an aspirational projection to give people some hope, but he's listening to us when we say we really got to reevaluate it in real time, and any decision we make has to be based on the data. I mean, the numbers that you showed, when you have a situation when the cases today compared to tomorrow is increased dramatically, and then the next day is increased dramatically, that's no time to pull back.
Okay, and I think that everybody gets that, right? Trump was expressing an optimistic date when he said April 12th. He was not saying we're definitely open by Easter, but, to have your eye on the ball as to when we reopen, that is a good thing. Now, it's time for a little bit of good news. So President Trump yesterday, he did an interview on Sean Hannity's Fox News program, and he suggested that he thinks the mortality rate for this thing is well below 1%. Now, just a few weeks ago, that was verboten. You weren't allowed to say that, right? Just a few weeks ago, if you said this, they claimed that you were downplaying the virus. They said that, no, the WHO is saying it's 3%. They're saying that it's 4% in some areas. Look at Italy, where it's 8% or 9%. The reality is it probably is below 1%, right? Likely the death rate on this thing is, the mortality rate is below 1%. It may be well below 1%. Again, we had on a doctor from Stanford University yesterday, and he on the radio show, and he suggested that this thing might look a lot more like actual influenza death rates than it looks like SARS or MERS, which is likely. As I say before, I think that the best data suggests that that is the case. Here's President Trump saying, I think the mortality rate is well below 1%.
One thing that I can say that's really good, the mortality rate is much, much better in our way than people were thinking at the beginning, because you were hearing 3, 4, 5%. And now, with all of the testing and all of the things, you see the people who die, you take a look at the people, I think you're talking about very significantly under 1%. And I think that's a tremendous thing.
Okay, and he's right about this. So again, if you said this a few weeks ago, if you said that the death rate looked a lot more like flu and a lot less like SARS or MERS, then you were considered a denier. This is one of the problems with fast developing scientific consensus, is that very often they are happening before you actually have the data in. Right? And by the way, Anthony Fauci was saying this, like in late February. On February 28th, there was a piece that he wrote along with Robert Redfield, who's one of the heads of the CDC, and Clifford Lane. And he wrote this, it was accessed last on March 26th, 2020. And in that article, he suggested that the best data suggests the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza, which has a case fatality rate of approximately 0.1%, or a pandemic influenza similar to 1957 or 1968, like that was actually called the Hong Kong flu in 1957, rather than a disease similar to SARS or MERS, which have had case fatality rates of 9 to 10% and 36%, respectively. So this has actually been a fairly well-known scientific consensus, it sounds like, for several weeks, is that this thing is far less deadly than originally thought. But if you said this in the media, then you were labeled a denier. Okay, well, the good news about that is that means that when we see vast swaths of people getting this thing, yes, some of those people are going to die, but it ain't going to be 3 or 4%. And if you get it, the chances that you're going to die of it, unless you are vulnerable prior, unless you're elderly, unless you have a pre-existing condition, are pretty low. Now, again, that doesn't mean that on an absolute level, like here, just the way stats works, you may be the one. Right? Okay, so this is why everybody should still be, concerned. But if you're just taking a lottery and the rates are 0.1%, like the influenza, that means that 1 out of every 1,000 people is going to die of acquiring this thing. Right? You acquire coronavirus, you die. That is 1 out of every 1,000 people if you're at 0.1%. Well, if you're the one, it doesn't matter what the rate was. If you're the one, your rate is 100%. Right? But if you are just taking your odds, it makes a very big difference. If somebody said to you, we're going to put a gun to your head, and now you have to pick one marble. There's 1,000 marbles. One of them is black. The other 999 are white. And if you pick the black one, you're going to die. You would feel a lot more confident in picking the marbles than you would if it were 10 times that rate. If there were 100 black marbles in there, or if there were even 10 black marbles in there out of 1,000. So that is some actual good news. And it does raise the question as to whether the lockdown measures that have been taken are actually the most effective. And by the way, I'm not the only person who's been asking that. I mean, Andrew Cuomo is asking that. Andrew Cuomo, the governor of New York, he said maybe we shouldn't have done a total shutdown. Maybe this wasn't actually the best policy. Right? Maybe we were over the top in how we did this entire thing. Now, I think a hard stop was necessary because we didn't have the data at that point. But as the data comes in, we're going to have to reassess this. And we'll get to that reassessment in just 1 second. But the kind of newfangled consensus is that the most catastrophic studies here are overstated. That the kind of estimates that huge numbers of Americans are going to die, hundreds of thousands of Americans are going to die, that is probably a wild overestimate. Deborah Birx, who's leading up the coronavirus effort on behalf of the administration, she basically lectured the media yesterday saying, you guys keep suggesting that all of our ICU beds are going to run out, that everybody's going to be sharing a ventilator, that there's going to be mass death in the streets, cats and dogs living together, the end of the world. And Deborah Birx, who's well-respected, okay, she has served in administrations of both Republicans and Democrats. She said this yesterday. Members of the media went nuts. They were very upset about this. How could Deborah Birx chide the media for citing the worst-case scenario statistics? How could she do that? And she was like, well, because those probably aren't going to materialize. Maybe you should actually give some nuanced information. Here was Deborah Birx just tearing into the media yesterday.
Please, for the reassurance of people around the world, to wake up this morning and look at people talking about creating DNR situations, do not resuscitate situations for patients. There is no situation in the United States right now that warrants that kind of discussion. You can be thinking about it in a hospital. Certainly many hospitals talk about this on a daily basis. But to say that to the American people, to make the implication that when they need a hospital bed, it's not going to be there, or when they need that ventilator, it's not going to be there. We don't have an evidence of that right now.
Okay, so, I mean, that is a pretty stunning statement, right? The media keeps saying, as I say, they keep saying kind of worst case scenario, we're going to run out of beds, ICU beds, there won't be any hospital beds, we're not going to have any ventilators, you're going to go into the hospital, it's going to look like Italy, where they're going to shuttle you off into a hallway somewhere where you choke for breath and then die, right? And Deborah Birx is like, guys, you might want to wait on that. By the way, it's not just Deborah Birx. It's not just Deborah Birx. Bill de Blasio, right, who's been as panic-stricken as any public leader in America, truly, right? Bill de Blasio came out today and he said, you guys keep talking about this protective gear shortage for healthcare workers in New York, and it doesn't exist. He said, there's a lot of fear. I don't blame any healthcare professional. Look what they're having to deal with. He says, the truth is we have, again, the supplies for this week and next week. We have to make sure every hospital is getting them to their extraordinary, heroic medical personnel. But they do exist, right? By the way, Andrew Cuomo, again, said the same thing. Andrew Cuomo said, we do have the personal protective equipment in New York. But if you watch the media, it's all nurses and doctors wearing trash bags, shortage of medical equipment. Everybody is going to die in the hospital after being coughed on by a patient with coronavirus. Everyone's going to have to share a ventilator. We're going to have to convert all the CPAP machines, mass casualties. Burke said, we were reassured after meeting with colleagues in New York, there are still ICU beds remaining. There's still significant, over 1,000 or 2,000 ventilators that have not been used yet. She said, stop exaggerating this thing. She says, you could be thinking about it in a hospital. Certainly many hospitals talk about it on a daily basis, but to say that to the American people, to make the implication that when there's a hospital bed, it's not going to be there, we don't have evidence. She said, there's no reality on the ground where we can see that 60 to 70% of Americans are going to get infected in the next 8 to 12 weeks. I just want to be clear about that. So when people say a huge percentage of Americans will be infected or have been infected, that may happen in the future, but not necessarily right now. Okay. And by the way, I trust Dr. Deborah Birx more than I trust the people at the New York Times. And until 5 seconds ago, it was people at the New York Times saying we should trust Birx and not Trump. So which is it, guys? Now, what I'm saying is replicating what Fauci said, right? I'm quoting Fauci and I'm quoting Birx. And yet, if you quote them, now this is controversial. Birx started trending on Twitter yesterday for having the temerity to point out that people are getting panic-stricken about this and that the media are deliberately stoking the panic. Which is, again, best data suggest that there will be a lot of people who die from this. We don't have the data. I mean, this has been my constant complaint. We don't have the data from the New York government, from the federal government, as to how many ventilators they actually think we're going to need. What are the priors? What are the inputs in that model? If it's bad data in, it's bad data out. How many ventilators we are going to need that we don't already have? How those ventilators are going to be deployed? How much the New York City system is going to be overwhelmed? Are there outlying systems where people can be shifted out of hospital beds? This is happening, by the way, in New York City. People are being moved out of beds that are not ICU beds, just kind of normal hospital beds, and they're being moved to other sort of medical centers so we can make room. Right? The Javits Center is being converted for normal hospital beds, right? You had a surgery 2 weeks ago and you're still recovering from the surgery, but you don't need ICU care. So we're converting over a lot of the beds that are in hospitals where you can have better treatment. And we're setting up hotel rooms and stuff for people who are just sort of in recovery, but all you need is an IV, which all that stuff is being done in real time. And again, there's still serious questions to be asked about the models that are being applied in the first place. Right, the Netherlands has been applying completely different models. According to Science Magazine, Martin Enserink and Kai Kupferschmidt writing, they say, with COVID-19, modeling takes on life and death importance. They say, the Netherlands has so far chosen a softer set of measures than most Western European countries. It was late to close its schools and restaurants. They didn't order a full lockdown. In a March 17th speech, Prime Minister Mark Rutte rejected working endlessly to contain the virus and shutting down the country completely. Instead, he opted for controlled spread while making sure the health system isn't swamped with COVID-19 patients, which, by the way, is sort of the South Korean model, kind of. He called on the public to respect the government's expertise on how to thread that needle. The predictions put out by Jacco Willinga, whose computer simulations are being used by the National Institute for Public Health and the Environment over in the Netherlands. Right, his simulations predict the number of infected people needing hospitalization will taper off as of next week. So there are some pretty stark differences between models, right? You had the Imperial College model that was suggesting that 500,000 people were going to die if there were no measures taken in the UK. I talked about this yesterday. And then yesterday, the head of that study suggested that thanks to the lockdown models, and then he sort of kind of slid in there, and also thanks to the lower death rate, he was predicting now that there might be only 20,000 people who died in the UK. That was not him throwing out his old model. It was him saying that if we apply heavy tamp down, then we are going to dramatically lower the curve. I mean, it's a pretty dramatic lowering of the curve from 500,000 to 20,000. But even his models are under pressure. Oxford put out a model that suggested the death rates were even lower than that. The Netherlands has put out models suggesting that this thing is going to peak next week. Willinga is confident that the number of new infections caused by each person when no control measures are taken is just over 2. He trusts data showing that 3 to 6 days elapse between the moment someone is infected and the time they start to infect others. Willinga says he is least confident about the susceptibility of various age groups, but he also suggests that we are not going to be overwhelmed in the Netherlands. Okay, again, there's this assumption that every case is going to be worst case like Italy or Spain, but the evidence that every case is going to be like Italy or Spain is just not there. right? It's not there at this point. Maybe it will be. Maybe it will be. We keep hearing that it's about to happen in New York City. That's why I say the tsunami may be coming. We just don't know because it's hard to know whom to believe. The story seems to be changing on a daily basis, right? The media are not particularly trustworthy in their tone and tenor, right? They're bringing you best available information, but so much of it is anecdotal. The New York Times every day is printing stories about a doctor or a nurse who says we're being overwhelmed at a hospital. And then you go to the hospital administration and the hospital administration is like, no, we're okay. I mean, we're stretched and we're strained, but we're handling it. And by the way, even in Italy, new coronavirus cases are actually slowing. According to Chico Harlan and Stefano Petrelli over at the Washington Post, Italy's nationwide lockdown is showing the first small signs of payoff. The number of coronavirus cases is still rising, but at the lowest day-on-day pace since the outbreak began. The WHO calls the slowdown encouraging. The health chief in the hardest hit region says there's light at the end of the tunnel. Italy was the first Western country to contend with a mass outbreak and order a lockdown. Now they're trying to figure out how long the restrictions could last. But the bottom line is that even Italy, which has been overwhelmed, is starting to tamp down and move beyond the day-to-day increases in the virus, all of which is a very, very good thing. But President Trump spoke yesterday, by the way, about the resources that are being applied in the United States. He says, we're shipping tons of resources. Like, people are pretending that we're not getting masks out to people. We're not getting personal protective equipment out to people. That's not true. Here's President Trump at a press conference yesterday talking about the numbers of resources being shipped all over the country.
Today, FEMA has shipped over 9 million N95 masks, 20 million face masks, 3.1 million face shields, nearly 6,000 ventilators, 2.6 million gowns, 14.6 million gloves, and we're sending more every day, and we've got tremendous amounts of equipment coming in.
Okay, so again, the notion that the federal government is doing nothing is just not true. And that is a real media bias. I'm going to get to more media bias in just one second. President Trump said last night on Hannity that hospitals are actually being set up in New York City. Resources are being brought to bear. Right, so the panic, in other words, maybe it's not, but may be overstated. And Deborah Birx, who I trust a lot more than the New York Times, is suggesting that the panic is overstated. I trust her more than I trust the New York Times. Dr. Fauci has not made any public statements, so far as I'm aware, that all of the systems in New York are going to be completely overwhelmed, death in the streets. We're going to have to choose between old patients and young patients. This is going to be Italy. Here's President Trump yesterday saying we're building hospitals in New York.
We're building 4 hospitals, 4 medical centers, and many other things. We've developed and sent thousands of ventilators, and hopefully they're going to do well.
Okay, so again, resources are being brought to bear. And this does raise the question, okay, so if we have raised, as I've said all along, if we have flattened the curve enough, and we have raised that line of medical resources enough that the line now clears the flattened curve, then we have to start having conversations about how to get back to work. And maybe that is not applied on an even basis across the United States, because not every place is a hotspot center of this outbreak. And New York City is a hotspot center. Is Des Moines, Iowa? Right? The LA so far has been really trailing New York. Is LA exactly the same as New York? I mean, major cities are going to be the epicenters of this stuff, but how about outlying rural areas? Are we seeing mass death in the rural areas, which, by the way, is where you sort of would expect to see mass death, considering hospital resources are far less. There are tons of counties in the United States that don't have a single hospital. There may be neighboring counties that have the hospital, but rural outlying areas, they don't actually have the medical resources being brought to bear, but you're not seeing mass death in those areas. So in 1 second, we're going to get to the question of when we reopen, because what you're going to see, it's pretty incredible, is that Andrew Cuomo and Donald Trump are basically saying the same thing. And Donald Trump is getting just his ass kicked by the media. And meanwhile, Andrew Cuomo is getting his ass kissed by the media. Right? Trump is getting his ass kicked, and Cuomo is getting his ass kissed. And they're saying exactly the same thing about how we reopen this thing, how we open this thing back up. And that is because the media's desire for a binary narrative in which President Trump is responsible for every cruel ill of the United States, and Trump is sitting there with his arms crossed, putting on the Trump frown and saying to people, no, not going to give the ventilators. I don't even care. I don't even like ventilators. Ventilators are bad. Like that's not happening. He and Cuomo are saying almost identical things, and the media is treating them as though they're saying things that are separated by 180 degrees, and it's just a lie. We can get to that in 1 second. First, it is indeed that glorious time of the week when I give a shout out to a Daily Wire subscriber. Today, it's Tiller on Instagram. He knows what it takes to get through the long work week. In the pic, Tiller is sporting an American worker trucker hat while holding the world's greatest beverage vessels in front of an eye chart that hilariously reads, Epstein did not kill himself. It's true, if you can see. The post caption reads, making parts for the Apache helicopter can be exhausting, but I'm able to work 50 plus hours weekly thanks to my refreshing Leftist Tears tumbler. Always refilling, sometimes hot, sometimes cold, always delicious. Hashtag Leftist Tears, hashtag Daily Wire, hashtag American Workers, hashtag USA, hashtag hot or cold, hashtag do work, hashtag thank God it's Friday. First of all, thank you to all of the folks in the supply lines. Thank you to all the folks in the trucking industry who are doing hard work each and every day to make sure there's stuff at the groceries, making sure this country is still moving. You see, folks, this is why you need to become a Daily Wire member. Don't take it from me. Take it from a man making the vital components of an incredible attack helicopter that supports the greatest military the world has ever known. And also my personal gender identity, Apache attack helicopter. Thanks for the pick, Tiller. Keep up the good work. Also, if you haven't had a chance to see some of our new content called All Access Live, you should head over to dailywire.com and check it out. Jeremy Boring and I kicked it off last week. All of the other hosts have done live streams over at dailywire.com. We're going to continue all this week at 8 p.m. Eastern, 5 p.m. Pacific. Basically, it's really just casual. We hang out. I literally have no program when I come on into All Access Live. So I'll just do whatever I feel like. Earlier this week, I just started playing Brahms on the I don't know why. And it was fun. So just come over and hang out with us. I know, listen, we're all isolated. We're all a little bit lonely. This really sucks. Okay, no matter how you slice it, it sucks. I'm glad we're safe, but this does suck a lot. So come on over to Daily Wire and join the community and hang out with us. I think the live streams are great, not just for our viewers, but for us over here as well. It makes us all feel better. So thank you from the bottom of our hearts and from our team to yours for becoming members. The show is intended for our all-access members long-term. During the national emergency, we've opened it up to all of our members. In doing so, we've accelerated the launch, so please let us know what you think of it. Also, if you're around at 8 p.m. Eastern, 5 p.m. Pacific tonight, join me, the famous Ben Shapiro, on All Access Live Show over at dailywire.com. Also, check out this Sunday, our Sunday special should be a pretty special Sunday. We're having on Vice President Pence and Dr. Deborah Birx. We're going to be asking them some questions on coronavirus and the path this thing is going to take, the media coverage in China. We're going to run the gamut with them. So make sure to tune in on Sunday. That will be available to all people, whether you are a subscriber or not. Head on over to dailywire.com anyway and subscribe. We are the largest, fastest growing conservative podcast and radio show in the nation.